Hi Ryan, welcome back to the clinic where we film many more scenarios. I'm Jeff, your student athletic therapist today with the Eskimos. How are you doing?
Good.
So I understand you still have that Facet sprain that we dealt with the last 5 days. We're day 5 now, so we're gonna start to do some rehab, build on the rehab that we've been doing so far. Mostly we're gonna be working on your posture, making sure that we're doing things throughout the course of the day, help with your posture, and to really get some good mechanics going so that you're kept out of the pain-free range, kept within a pain-free range as often as you can be. If there's any still acute inflammation in there, we're going to try to minimize that today as well. Mainly try to decrease the pain. If we can restore a little bit of range of motion today, we'll start working on that over the next few weeks, but we'll see if we can make some minor increases in range of motion. Strength we're not too worried about just yet. We're going to focus on the range of motion for the most part. But I'd like you to keep a journal along the way because this pain might be bothering you out throughout the course of the day for the next little while. So at least if we record it, we can kind of keep track and see how you're improving along the way.
Yeah.
In terms of return to sport, we want to deal with mostly the muscle spasm pain right now. Get your range and strength back up to full, so we're not looking at a return to sport right away. But we'll keep working on the things we can do as we progress over the coming weeks to get you back to full functional capacity. In terms of your neck and your posture, like I mentioned, your posture is going to play a big role. So we're going to make sure that everything from your shoulders to kind of your shoulder blade setting, everything like that is addressed today, so that throughout the course of the day you're preventing yourself from making the injury worse and being able to manage that. In terms of your cardiovascular exercise, we'll try to maintain that as well, so that if you're able to, you can keep up with your cardiovascular fitness and not lose any cardiovascular endurance that way. So for the most part, that's what we're going to try to do and give you a home program. Like I said, tries to minimize the pain throughout the day and mostly increase range of motion. Other than that, we're not going to focus too much on your core today, other than just your scap setting and trying to maintain good posture throughout the day. Do you have any questions, or would you like to proceed with the treatment?
No, let's get going.
Perfect. So the first thing I've noticed, you're sitting kind of with a rounded shoulder posture. Is it still painful to sit up straight, or are you able to do that?
No, I can do that.
Okay. The first thing, before we get too much into your neck, I just want to take a quick look to make sure there's no... I still see on the right side of your neck there's a little bit of heat compared side to side and some redness. I want to try to heat up the area around it a little bit so that we can do some exercises around your neck. So what I'm going to do is just put a heat pack over your neck. Before I do that, I just want to clear a couple of contraindications. Do you have any allergies to heat or any reduced sensitivity peripherally? So like Raynaud's disease, anything like that?
No.
And no allergies to heat? Good. Do you have any like metal plates or pacemakers or anything like that?
No.
No? Do you have, I'm looking at the site, it doesn't look like there's any open wounds or sites of signs of infection. Do you know if you have any infection?
No, I don't.
And do you have any medical conditions like diabetes or cancer, peripheral vascular disease, or
Thrombophlebitis?
Yeah, that one.
No.
Do you have any of that? Okay. Perfect. So the first thing I want to get test out real quick before we get started. Do you mind taking off your shirt? I just want to test hot and cold, just to make sure you don't have any impaired sensation. So I'm going to be testing it down your neck and shoulders, where I'm going to put the heat.
Okay.
So this one is going to be cold, and this one is going to be hot. So when I put one on, you'll have your eyes closed and then tell me which is which.
Cold. Hot. Cold. Hot. Cold. Hot. Cold. Hot. Cold. Hot.
Good. So what I'm going to do with this heat, I'm just going to drape it over your shoulders. I have a towel here as well, so let me know. It's been sitting out for a little while, so it's warm. It's not burning hot. but I'm gonna just put it around the back of your neck.
Okay.
If that's too hot, we can add another towel to it. If it's not hot enough, I can remove the towel just to put it on top.
Okay.
Is that comfortable on there like that?
Yeah.
Good. What I'll get you to do is just lie down on your back, on your side. And with the compression, that's not too hot. Good. If you want to stop at any time, let me know and I'll just remove the hot part.
Okay.
You're comfortable like that?
Yeah.
With a pillow?
Yeah.
That's comfortable? Good. Okay, so we're going to leave you there for 15 minutes just to help keep the shoulders and area around the neck to start.
Okay.
So 15 minutes later. Okay, so the next thing we're going to do, if you want to take a sit up again, like I said before, the major thing we're going to try to focus on today is working on your posture. So what I want you to try to do, can you leave your shirt on for this?
No, it's cool.
So what I'll do first, you're comfortable like this? You're comfortable sitting here? Is it painful at all?
No.
Good. Okay, so the first thing I want you to do is, now that we've heated the area, warmed it up a bit, made it a bit more mobile, what I want you to work on is setting your scapulas. So you're sitting with kind of a head forward posture. What I want you to do is go from this and just bring your head back so your neck is in line with your shoulder. Good. And try to strengthen. You don't have to sit like you have a pole going up your spine, but you can just sit comfortably. And what I want you to try to do is bring the inferior poles of your shoulder blades, so the back of your shoulder blades, together in the back. It's a very subtle movement to strengthen through here. So just do a very subtle retraction of your shoulder blades.
I already did.
Good. I can feel that you have this retraction. So since is this painful on your neck at all, where you have the facet injury?
No.
Good. So what I want you doing through right now, I just want you to do 10 subtle movements where you bring your shoulder blades back, holding for 3 seconds, and then letting them go. Okay. So try that for me.
Okay.
So once that's done, I want you to continue with these throughout the course of the day. So at 3 different points during the day, I want you to do 10 reps of these like we did. What do you do? What do you do for work? Or are you a student, or what do you do?
I think I'm a teacher.
Oh, you're a teacher. Okay. So if you notice you're sitting at the desk throughout the course of the day, I want you to try to do this as often as you can to help prevent any issues you might have from sitting forward all the time.
Okay.
You think you could do that?
Yeah.
Perfect. Do you still have any pain in your neck at the moment?
No.
Okay, let me know if any of these exercises flare up the muscles in your neck, and we'll address it with TENS.
Okay.
So, the next thing I'm going to do is, the exercise I'd like to try is just increasing your range of motion. So what I want you to do is just to check your range today. So just start with just flexing your neck forward to just bending your neck. Do you get pain with that? No pain with that?
No. Well, yes. A little bit of discomfort.
Okay, so what I want you to do is bend forward, and then when you get to a 2 out of 10 for pain, just stop there and bring it back a little bit. Okay. So you're comfortable there?
Yeah.
Okay, what I want you to do is hold it there for 5 seconds, and then go back to neutral. The next one I want you to do is just extend, same thing. Find where you can go with pain, and then slightly withdraw from that area.
There's no pain.
There's no pain going backwards. Good. So we won't worry about too much with that range since it's full right now. The next one I'll have you do is turn over your left shoulder. Is there any pain with that?
Yeah, there's some slight discomfort.
Okay, it's the same as before. Just come out of that range a little bit to where it's not painful. And just, do you feel like a stretch or anything like that?
Yeah.
Good. So what you can do is hold that if it's not painful for 5 seconds, and then go back to your right side. Any pain with that?
No.
Okay, so that one's good. We're not going to worry too much about stressing that one. The next thing is just bending your left ear towards your left shoulder. Do you have pain with that?
No, but it's full range.
Okay. So if it's full range, we're not going to worry too much about that one. What about bending to your right shoulder?
Yeah, there's some discomfort, but it's full range.
Okay, it's the same thing. If you can pull back where you still feel a bit of a stretch before you get to that pain. I want you to hold that. And what I want you to do with all these exercises to really use them as a stretch is same as I talked about before, pulling back through your shoulder blades and maintaining that upright posture through your spine and shoulders.
Okay.
The good thing is too, because we use heat, it's helped decrease any spasm that might be present in the traps that we've seen before. So in terms of proprioception, I'm just going to use the exercise that we have right now for scap setting. Your scap setting is actually really good, so I'm not going to have you worry too much about it. If you do know that these muscles start to get sore, you can ice after. But let me know if, let me know as we go through this treatment if you have any excess pain from the exercise we're doing.
Alright.
So the next one I want you to do is I just want to further increase your range of motion, especially around your traps and neck.
Yeah.
To help stretch these muscles out. I just want to show you a quick stretch you can do for your upper traps.
Okay.
So what I want you to do is, I'm just going to sit here for a second so I can show you what I'm going to do. What you're going to do is you're going to sit on your hands, and then you're going to maintain that good posture. You're going to bend your neck, as long as you don't have pain. You're going to bend your neck to your left side. Hold that for 30 seconds, and then go back to your right side, keeping your shoulders down.
Yeah.
Stretch out your left trap for 30 seconds.
Good.
Do you have any pain in your neck with that?
No.
Good. And then go to the other side. After the 30 seconds. You pain with that?
No.
Good. So I want you working on this stretch today, as well on a daily basis. This will help keep your traps loose, especially in the case we have a neck injury. So